Hello, everybody. I hope everything is fine with you, and greetings from rainy, rainy Finland. We had some minor technical issues here before we started, but let's hope that everything will be fine. And warmly welcome to HUR Academy webinar, where we wish to look closer to the situation caused by COVID-19 and what kind of impact the pandemic has on strength and everyday life. My name is Lena, and I am the Executive Vice President at HUR. And today I am also your MC, but I am not going to do any rap performance, I promise you. We have people from many, many countries here attending this webinar now. So some of you, it's really, really early morning, and some of you have evening time. But let's hope we can keep you awake for next 1.5 hours. And now let's see if I can get my slides on. This is interesting. Let's see how technical I am. Yes, okay. So today we will talk about Lena during COVID-19. And I will do this first because first of all, COVID-19 is a huge, of course, issue in every country here in the world. And of course, here in Finland, we have been quite lucky. Our government made quite strict restrictions already in beginning of March, and some countries has not been so lucky. But the pre-rehabilitation and rehabilitation concerning COVID-19 is something that we are very concerned about. So I will talk in my presentation a little, take a case about pre-rehabilitation and what kind of impact the restrictions we have had on one person. And after me, we have Dr. Arto Hautala, who is the Director of Research and Education here at HUR. And Arto will talk about rehabilitation depth because of COVID-19. And finally, Ms. Nyyti Saikkonen, the physiotherapist and the education specialist here at HUR, will talk about practical implications for lifelong strength during COVID-19. And we will end, of course, with questions and answers. And here is a practical announcement concerning that. So please use the Q&A section for questions for panelists. If you like an existing question, then please upvote the questions with thumbs up. And some of you maybe are not so familiar with HUR company, or HUR as we say here in Finland. And here are some key facts. Founded at University of Technology in Helsinki in 1989. And the headquarter, parent company we have here in Finland at the west coast to Sweden. And subsidiaries in Australia, Germany, Russia, and also in USA, of course. Distributors we have in more than 60 countries and also installations. And right now, I am so grateful for all our cooperators out there, like subsidiaries and distributors and customers, because you have been really believing in us, even though it has been a challenging 2020. And without all of you, this would not be possible. And also here I wish to thank our lovely staff. So all the employees here at HUR in Finland have done also a great job during the challenging time. And since my aim is to talk about that HUR takes care, I wish to share our values with all of you. These values are the leading star for all our activities and actions. And at the same time, you can see a nice picture here with our employees. Greetings to all of you with our Finnish flags in their hands. And caring is crucial. And we have a big passion to what we are doing. And of course, to do the right things, we need knowledge. So knowledge is the key. And therefore, we are very happy for our research and education department led by Professor Arto Hautala. Because as I used to say, it's not enough that you make wonderful equipment. You also need to know how to use them in a proper and right way so that we really get good results. But alone, you are nothing. So success is shared. And therefore, we are so grateful for all of you out there who are believing in us. So together we can maybe not move mountains, but we can contribute to a quality of life. And HUR takes care. And this is so important for us because this is the heart of HUR. And we have for a long time already had the slogan, give them the strength they need for the life they deserve. And this is something we really believe in ourselves a lot. So that helps us to be a part of the contribution to solving the big socio-economic challenges that we have today. And last but not least, you have also greetings from Gretel, 93 years old, that you can see on the picture. And this is my mother. And many of you know her story at age 86, when she was going through her hip replacement surgery, and how we were able to rehabilitate her back to an active life. Today, my mother is 93 years old, and the lockdown we went through in Finland this spring because of the pandemic and the restrictions by our government was extremely hard for her. And not only for my mother, also others elderly in same situation. Her service center stopped all activities and training. We relatives were not able to visit our elderly, and meals were brought to their flats. My mother, who is a widow, was left alone almost all the time in her apartment. My mother started to suffer from anxiety, depression, and she even started to hallucinate. She saw us, her children, grandchildren, and even grand-grandchildren, though through the window, though nobody was there. And we were really afraid what this will happen, what will happen to her. So the inactivity and the social isolation had a big negative impact on her memory and brain. But at end of summer, we were able to move her into a new senior center, Emeliehemmet, that you have a picture of. And also the restrictions were not so strict anymore. And now, in this senior housing, they have a lot of activities. They are training on in their new HUR gym, as you can see also on the picture. And she has a lot of new friends there and almost no time to meet up with us anymore. And this is very lovely for us to know. So she's happy and independent, again, enjoying her life and activity of daily life. So for her, the rehabilitation is extremely important to keep her up and going. So at the end, I just would like to say to all of you, let us take responsibility now and make sure that we don't have to go back to lockdown again. And therefore, wash your hands, keep distance. And after all, caring is crucial because of this. Thank you. And now I would like to give the stage to Arto. So Arto, take your place. Thank you.
Okay, thank you, Lena. Dear colleagues, ladies and gentlemen, let me first try to find my slides over here. So, and then let's see over here. Okay, and once again, I need to put the settings. Okay, please hold a second. So I think that now it's going to be okay, and I assume that you are also seeing the pointer of moving over here. So please, Lena, please say something if you don't see my slides or if the pointer is not available over there. So I'm very happy to say and notice that there are so many of you participating to our webinar. So I really appreciate your activity to participate, and hopefully my talk will give you maybe some new ideas and at least some fruitful discussions to go further. So my topic is the rehabilitation depth because of COVID-19, and here you can see the contents of my presentation. So first of all, I would like to figure out something related to risk factors, and we take a look about let's say that today we know this quite well, that what is the mechanism for severe, especially severe corona infection. And then we go to discuss, or I'm going to show you out that what we know today about the role of physical fitness related to this pandemic era. So you are very familiar about the consequences of physical inactivity, but anyway, I will rise this up again, a couple of examples about it, and then lastly, I will like to rise up some ideas or maybe some future directions, and let's see what we have over there, and then a short summary. So let's start with the with this data coming from England and Wales, and here you can see the deaths registered during the COVID-19 from March to April, and here you can see the numbers of deaths and here the weeks. So basically what I would like to highlight over here is that when we take a look, let's say that, for example, we can call this kind of baseline, and then how much additional deaths is going to occur over there when we come into weeks 15, 16, or 17. And interestingly also that not only COVID-19 only related deaths, but additional deaths as well. And this may highlight the idea that about the role of, let's say that some other diseases or related comorbidities and COVID-19 altogether will show that those very, very high numbers shown over here. And also, this is quite interesting to highlight that let's take a look now only at the COVID-19 related deaths and what is the age and gender distribution of deaths. And as we see over here, so let's say that something like 80%, about 80% of those deaths are related to age over 75 years and older. So this gives us an idea that what does this mean if you think about severe, very, very severe, let's say, the final consequences related to COVID-19. So this is also interesting. If you think about the, let's say that this is one of very serious complication related to several diseases. So I'm talking about venous thromboembolic complications. So before COVID, we know this, according to statistics, that there is something like 1 per 1,000 cases or patients where this complication occur. But when we coming to COVID-19 patients, we can see that the incidence is something like 20%. So very, very high incidence related to this severe complication. And the other important issue I would like to highlight here is that you can see here on the left side that there are 19 published high-level, let's say that high-level published studies related to only this VTE complication, highlighting the topic and the issue about that during this pandemic era, we are all the time learning new issues related to this. We understand better the pathophysiology about this disease. So all the time new data is coming out and they are going to be published. And I'm going to show you something just published studies over here as well. So let's take a short look about what do we know about the pathophysiology for severe COVID infection. So today we know quite nicely that how the virus enters the host cell. So by attaching to the acetylcholine enzyme receptor. And because we know that those there are a lot of those receptors in the endothelial cells, so basically in the wall of vessels. So it means that there are a lot of places where the virus can enter. And the main issue first was when this disease was recognized that it is basically a lung disease causing an very high level inflammation. So the term what have been used lately is the cytokine storm. So a huge amount of inflammatory factors over there. But coming to this story, that when there is a cytokine storm, it of course activates immune system, and that's why remembering that we have a lot of those places in the vessels where this virus can enter in. So we know that, for example, not only coming to the lungs, but for example, coming to the heart. So we know that it can cause myocarditis and some markers, for example, the marker of damage in your heart, troponin 1 level can increase. So basically this is the story. And I think that in a way, this explains quite nicely that why those symptoms of this disease, there are so many consequences related to this, and the symptoms are, there are so many kind of symptoms related to disease. In a way, this figure, at least in my mind, explains this a little bit. So coming to the recognized risk factors, so not age itself, but also, as I already actually mentioned earlier, if you take a look about, for example, heart failure, waiting list for cardiac surgery, so diabetes or severe overweight, so they are in the list, and that explains maybe the figure I showed you first, coming to data from England and Wales, that there are not only, when we take a look about those deaths, not only COVID-19 related deaths, but also those deaths that which were kind of related to comorbidities or some other diseases together with COVID-19. So what do we know about the role of good physical fitness related to fight against this disease? So I would like to first highlight this. This is old data coming from Dr. Niemann, and he has published quite a lot related to topic. But we know that if there is a certain amount and intensity of, let's say, that regular exercise training in a week, in a month, and so on. So here you can see the risk of upper respiratory tract infection, and here you can see the amount of exercise. We know that there is kind of J-shaped model for this relationship. So basically showing that if you have the regular exercise training, it's going to give you some cover for upper respiratory tract infection. And and on the other hand, this is probably the same figure, J-shaped relationship showing the role of exercise workload and what is the risk of infection. And we know that it's going to rise up the immune function when there is a certain amount of exercise. So it is said over here quite nicely that we need to boost the immune system to reduce the risk of infection over long term, to keeping this exercise training in a regular mode. So here is one of the potential mechanisms how good physical fitness may give some protection against COVID-19. So first of all, by reducing the expression of toll-like receptors, they are proteins that play a key role in the innate immune system. And because we know that exercise training reduces the expression of TLRs, and in a way increasing the levels of anti-inflammatory cytokines such as IL-10 or IL-37, they will in turn inhibit this pathway. And the other, or the next potential mechanism, if we take a look about this AMP activated protein kinase. So this is an enzyme that plays a role in the cellular energy homeostasis. This activates in lung, and then it's reduced the inflammatory processes. And in that way, the consequence, of course, is that it's going to improve lung function. So this is maybe some of the first issues to understand better that why we need to do the exercise training on a regular basis, or why do we need to recommend it. And also, if you want to read this is from our web pages, but we know there are some evidence from animal studies and also human studies that muscle can act as an immune organ by producing this acute phase protecting proteins. So giving an idea from that regular strength training might be a crucial preventive action in this area as well. So giving kind of a conclusion, what I have just tried to explain. So taking together, let's say that those metabolic issues. So you remember now that there are those risk factors, obesity, severe obesity, maybe leading even a diagnosis of metabolic syndrome, even to type 2 diabetes. Then if we are physically inactive, and then about the aging itself. So all of these issues altogether may lead to immune dysfunction and decreased viral defense. And then coming to this impact of regular exercise, improving and reinforcing immune function. Maybe, as I explained, it lowers systematic inflammation. And I'm going to talk a little bit more about this improved vaccine efficacy, because all of you know that we are in the middle of discussion that when this vaccine is coming to the markets. And now it's going to be quite an interesting that when we put let's say that daily habitual physical activity or exercise training together with vaccine, how does this affect? So highlighting the role of exercise training as well. And also, yes, please take a look about this Europe Active. Here you can see where you can find this documentation. This is quite nice, just published. Let's say that the good overview related to role of physical activity or exercise training in this pandemic era. So, consequences of physical inactivity. I think that this is quite a nice example. This data is coming from UK. And as you can see from the title of this publication, it says that most aging adults are unable to cross the road in time. So it's also interesting to take a little bit closer look about this study. So if you think about the crossing the road, and if there are lights over there, so when there is a green light, you need to have the capability of walk 1.2 meters per second in that speed that you are able to go across the street during the green lights. So they take a look about quite a reasonable number of aging adults over 65 years, and they documented what is the walking speed, and they noticed that about 90% of adults over 65 years had walking impairment, so they couldn't walk fast enough. And every one of us can easily understand that what does this mean, for example, in terms of quality of life, or if you need to go to the grocery store or to the library or something else. So basically you need to have this physical performance or capability to walk at this speed that you are able to cross the street when the green is there on. So I don't know what is the correct term or what would it be, but we have had a discussion about the home isolation during this pandemic era. So we know that there is a certain consequences of inactivity to cardiovascular health. So I'm not going to details of this, but I think that they are quite well-known consequences. And of course, we know that if we think about physical activity, and especially if there is a lockdown or if you are restricted to stay at home, so it's very important to highlight or rise up the practical rules, that practical guidelines for home-based physical activity to boost this cardiovascular health issues. This is highly important. You noticed that in my title there was an rehabilitation depth mentioned, and here this data comes from Italy. This is just coming to be published, but we can see over here that when we take a look about the physical functioning measuring parameters, so chair stance, short physical performance battery, or the paddle index as well. Whatever we take a look about in this figure, here you can see the number in percentage of COVID patients. And here you can see that what was, for example, the level of very low performance according to SPPB when they entered to rehabilitation hospital. And when they were discharged, we can still see that the level where the physical functioning was impaired was something like 50% of those patients. And when they entered in, so it was something like 80%. And this means that, let's say that after about 1 month, so about 32 days, when they recovered in that level that they were able to go back home, so still there was a huge impairment in the physical performance of daily activities. And I think that this is, and this kind of data, I'm quite sure that there are going to be a lot of this, but This I just found, and as I said, this is coming from Italy. So I just want to show you something that what we really can do if you think about rising up the issue that how can we, Lena was mentioned that rehabilitation is important. Of course, it's important. And when I'm showing you this shortly, this pilot study data, this was performed before COVID-19, and it was performed here in Finland in our senior care facility 24/7, which means that basically those seniors, they are, during most of the day, they were lying in a bed. So here you can see the participants. So we had two groups, the intervention group and then the control group. And you can see that the age was something like 85, 87, so a little bit less than 90 average age. Duration of intervention was at least 3 months, but nearby 12 months for all of those who were involved in intervention. And of course, there was a huge amount of variation concerning about the visits to the gym because of several reasons. For example, the health status and the clinical status in overall. But anyway, here you can see the participants, and here you can see the HUR strength training facility over there. So basically, big muscle groups, first familiarization period, then targeting to 8 to 12 reps, something like 60 to 80% of one repetition maximum. And then, of course, importantly, what our system allows, there was this automated progression of strength training, so the auto update mode was in use. But then coming to results, so this is important in that way that now please take a look about, this is chest press, 1 repetition maximum, so dynamic maximal strength level, tested pre and post. So the absolute level of chest press was something like a little bit more than 3 kilos. Now you can think about that. What does this mean if you have a weight in your hand that your maximal capacity is to hold it is 3 kilos? So it's not very much, but very nicely, almost 90% increase. And now we are moving to the level of about 7 kilos. Of course, this is not very high, but anyway, very nice results. And the same comes when we are coming to take a look about your upper body. So leg press values, 1 repetition maximum value again. So not very high level. For example, if you think about, I was talking earlier related to walking speed, but anyway, very nice big increase in the absolute, in terms of absolute values of legs in this case. And what does this mean? You know that it is, of course, you have the intervention, you measure your maximal strength pre and post, so you can see very often the change independent of the baseline level, 20 to 30, even 100%, as you can see over here. But what does this mean in terms of activities of daily living? So here I also take a look about this Interarray Assessment System parameters. I will introduce you a couple of, actually 2 of them. And this is a system developed to home care assessment, and basically means that this is worldwide use, and probably many of you are familiar with this, but this is a scale, in this case, for example, for independent dressing. And meaning that if you have a high value, it means that you are not doing very well, you are doing worse. And the low value means that you are doing very well in this daily activity task, in this case, dressing. And what our pilot data shows, it shows that those who were involved to the intervention, they remained the same level if we compare the values of pre and post. But those who were in the control group, they had a little bit more difficulties related to independent dressing. Of course, this is trend, but nearby the statistically different chains. And a similar issue coming to, of course, one more very important independent daily activity task. So I'm talking about eating. So independent eating, so again, the same thing. They could stay at the same level who were involved in the intervention, but those who were in the control group, they had more difficulties in independent eating after this time period. So what about these future directions? I think that I'm right in a correct timing. I have something like 5 minutes left. What is coming next? What can we expect to have in the discussion, and what are going to be the topics or discussions? What needs to be done next? So I will talk a little bit about the vaccine and exercise training. Then I would like to rise up for you to think about that. Do we need some new definitions for strength? And then what is going on with do we need to refresh our rehabilitation guidelines because this COVID? We know that, or at least it seems that it's going to be last quite a long time, even though we have those vaccines, but we don't really know that. So this is very interesting data. You can see that this is published something like or 10 years ago by Dr. Woods and colleagues. I find this highly important. So here they were taking a look about the antibody response to influenza vaccination. And here are some markers to antibody response. And then they compared, in this case, this was a randomized controlled trial, of course, aged adults were involved. And then there was an aerobic group, half of the group about, doing 3 times per week training. And then as a control group, there was a flexibility training group, so 2 times per week, 75 minutes. And quite nicely, they showed that whatever the marker we are taking a look about the antibody response, this group who did the exercise training, they could extend the antibody response to influenza vaccination. And this is very important when we are going, I don't know when this happens, maybe it's available somewhere in the world right now, but when we have these vaccines, it seems that according to this data that we can extend the antibody response when we put exercise training, strength training, aerobic training to the daily programming. So I believe that this kind of studies are going to be in progress quite soon when we have this vaccination and when we have first, of course, let's say that this normal response and if there are any severe consequences related to vaccine. But anyway, we are coming to this that there are probably going to be studies which will hopefully see the similar kind of results and it's shown over here. So thinking about strength, very often we are discussing about your maximal strength level for certain muscle groups, for example. Then we can talk about certain different deeper, let's say that sub or modalities of strength. So I mean that the endurance type of strength or something like this. But then coming to, let's say that some new ideas, thinking about the determination, what strength means. In this just published paper, they are discussing about the mental strength, and they connect this quite nicely to exercise training, nutrition. What is the adaptability and crosstalk between of those? And actually, especially during this era when we are living what we are living right now. So, and especially for aging adults, this is highly important. And of course, I'm very happy to show you this, that I was dealing with the same topic. I was writing this short overview according to the scientific literature about the topic a couple of years ago. But as you can see, the term was not similar. So they, in this case, they were discussing about the mental strength, but I was talking about brain strength. And of course, please, if you want to see this short story, you can read it from our web pages. So one more issue, thinking about the future. I'm not quite sure if there are any others right now available, but this was just published, and this is cardiac rehabilitation activities. This is a guideline coming from Italy in this case. And this kind of classification or outcomes, which you are very familiar with. So in this case, short physical performance battery can be used for classification for the functional capacity. And then there are some actions for rehabilitation of physiotherapy programming. What kind of actions you need to put in to the program when you are facing these patients. And I believe that these kind of guidelines, probably they are going to be kind of similar, I believe, but they are coming in the near future as well. Okay, but I think that Newty will deal with this, let's say that more practical issues quite soon. So it's my time to make some summary. So I hope that I have proved to you that good physical fitness probably gives protection against COVID-19 virus infection, and maybe the mechanism for that is that it results in several positive changes in immune system function. And of course, this lockdown or home isolation or restrictions during this era challenges every society to promote daily physical activity and exercise training. And also, I would like to that you remember that all of you are needed. New ideas and approaches are needed to ensure lifelong strength and appropriate quality of life. I don't know what the new normal is, or are we living in it? At least we have learned to do a lot of these activities home-based, but let's see what's going to be happen. So I want to thank you. I appreciate your participation to this webinar, and now I think that it's time for me to shut down and mute my mic and give the talk to Newty. Newty, please go ahead.
All right. Thank you, Arto, for shutting down. I hope everybody can hear me and maybe even see me. But yeah, nice to see that you're so many here today listening to our webinar. And thank you to Lena and Arto. And Lena has already introduced us, so I won't go into details in this. I will now find my presentation and try to get it visible for you as well. And please let me know if you cannot see it properly. Okay, here you can see my topic for today. I will talk about the practical implications during COVID and especially in the rehabilitation of COVID-19. I have three main topics in my presentation: the physiotherapy management in clinical hospital settings, not so much about the physical therapy itself, but about the practices and the recommendations. And then also some preliminary recommendations for early rehabilitation after the hospital discharge. And then, of course, to remind you about the general guidelines for exercise. And then last but not the least, some ideas of how we can contribute as a company, or our machines can and solutions can contribute in or during the pandemic. Just one sec, I will try to check my time, otherwise I will. Okay, so about the physiotherapy in the hospital during or for the patients that has COVID-19. And it's mainly about respiratory and functionality supporting actions. For the patients who had moderate or severe disease, basically the primary objectives are rehabilitation. In rehabilitation are promoting the airway clearance, the breathing, and of course preventing the complications of acute illness related immobilization. So laying in bed, laying in ICU. But not all the patients who are in the hospital or who have COVID-19 obviously don't need physiotherapy or respiratory physiotherapy. And what I also want to a little bit talk about is the workforce planning and preparation. That includes screening and determining the indication for physiotherapy together, and delivery of the physiotherapy intervention, of course the personal protective equipment and the requirements, and staff planning, staff education, and so forth. And then of course the safety and the hygiene issues obviously are very important in this matter as well. And here on the right side, you can see the World Physiotherapy recommendations for the personal protective equipment or the usage. And on the left side here is a set for physios who's treating somebody who has confirmed COVID-19. And then on the right side, if the patient has COVID-19 and then also a significant respiratory illness. And the difference here is what kind of mask they're using. So surgical mask on the, or let's say only COVID-19 case, and then a high filtration mask if the patient has another or important comorbidity that is affecting this case. But who to treat in the hospital? So many times COVID-19 is associated with dry, non-productive cough. And in these cases, there is no need for respiratory physiotherapy. Although if the patients are concurrently or subsequently developing executive consolidation, so there are changes in their lungs or troubles of breathing or difficulties of clearing their secretions, then they need respiratory physiotherapy. And like I mentioned, if they have comorbidities and if there is a risk of functional decline or there is a functional decline, or for example, ICU acquired weakness, then the physiotherapy interventions are at place. But important to note that only if there is clinical indications for the physiotherapy. And of course, to remember that the staff exposure should be at minimum at all times. And also when we think about the PPE supplies. So not necessarily or no necessary review of patients in the isolation areas. And also cooperation with medical staff, with medical doctors and the other staff to determine the indications for physio, and then screening and treating according to the agreed guidelines. And as soon as possible or whenever possible, the screening through subjective review. So basically not entering the same room, maybe calling the patient, trying to make a subjective assessment on the phone and give information or education on airway clearance techniques or mobilization or so forth. And these guidelines are mainly from this paper here underneath, Thomas et al., Physiotherapy Management for COVID-19 in Acute Hospital Setting. And just what I mentioned about respiratory physiotherapy, just to illustrate you that not always is physiotherapy necessary, but if there is morbidities or changes in X-ray, difficulties of breathing, fluid in the lungs, then physiotherapy is needed. And mobilization and exercise is needed whenever a patient is at risk of having a functional limitation, or they are old, frail, multiple comorbidities. And examples for physiotherapy in the hospital setting in this case and this stage is position change. Seated position should be promoted whenever possible. Prone position ventilation, because this it has a positive impact on oxygen binding and pulmonary dynamics. Passive joint motion, muscle stretching, bedside standing, walking exercises, and then of course later on when the patient is in this stage or phase that they can do some physical strength and endurance training, then of course this. And then recommendations for the exercise and mobilization. Again, of course, protective equipment usage, droplet or high filtration masks. The importance of screening, so it should be done actively, accept referrals for mobilization and exercise, but it should be discussed together with the patient, of course, but then with the nursing staff, with the families, and discuss whether it's possible for somebody else, for example, or give the aid or the instructions for the patient without the physiotherapist in this stage to going into the patient. And early mobilization at all time advised whenever possible and safe. And of course, the patient should be encouraged to work on their mobility in their rooms, for example, stand up from the bed and walk a little bit in the room if they're able to do that. But then again, the training and assistive equipment should be considered quite carefully, of course, to be able to take care of the proper decontamination, and of course, equipment that is for single patient use. And this brings us to the planning. So the equipment and the therapy and the staff, everything should be planned well. For example, to use the minimum staff in the rooms, ensure all the equipment is there and available and working before you take it into the isolation areas or to the patient, and maybe staff training even for the cleaning and so forth. And then of course the patient safety, if the patient is ventilated, airway security is very important. All right, then let's jump into the preliminary recommendations for the early rehabilitation. So this is the rehabilitation after when the patient is discharged from the hospital. I want to show you this picture. It's from the World Physiotherapy, because it quite well shows the impact of COVID-19 and the multiple issues that we need to take into account in the rehabilitation. Obviously impaired lung function, but then muscle weakness that Arto also mentioned, joint stiffness, fatigue, limited mobility, cognitive issues, psychological issues, troubles of swallowing and communicating. So a lot of things. And here we continue to the fact that there's even more. And the purpose of the physical rehabilitation or the rehabilitation, depending on what we're looking at, of course, supporting the recovery and getting back into the daily activities and the society, and to prevent more psychological disorders. And then treating the symptoms you saw earlier in the picture, but then in addition, Also lower quality of life, another kind of pain than only joint pain, weakness, low exercise endurance. And it is advised that an individual assessment should be documented when the person is discharged from the hospital. And it should include, for example, immediate needs like safe mobility, symptom control, if there's any need of supplement oxygen, and short-term needs, improve physical, emotional functioning, returning to work, so that these can be used in the physical rehabilitation and in the rehabilitation afterwards. And one very important issue is, I think, to establish the holistic view of the rehabilitation, because there's a lot of mental issues and physical issues that many times do walk hand in hand with each other. But there is a lot of, like Arto said, that we don't know about COVID-19. We're learning all the time more, but we can, of course, also learn about quite similar issues that we have had with ICU survivors, so patients with COPD or severe influenza, and so forth. And what we know about COVID patients is that for the ICU admitted patients, the ward stays and the prognosis is really bad, and the ward stays are quite long. So that means that, and with this whole slide, I want to illustrate that the patient, they really many times do have poor physical and mental state. And the exercise rehabilitation and the rehabilitation is very important, and also the time frame, and to start it as early as possible, of course, already in the hospital. And like you can see here, we can improve quality of life with exercise or rehabilitation programs, self-efficacy, readiness to exercise. And the greatest change, according to this paper here, the last one, is that during the first 2 months after discharge, the greatest change in physical function occurred. So it's important to start it early. So the first 8 to 10 weeks are important. But the thing is, still, we don't know what the expected impact of the rehabilitative interventions are to COVID. And here you can see two syndromes that I wanted to mention, because these two cases, they have big effect on the patients, on the mental and physical health. And in addition of these, also post-traumatic stress disorder and the symptoms of this disorder can be seen also in the patients that has had COVID, but also in the family members close to these patients. But post-intensive care syndrome, according to the clinical experience from Italy, there are several problems after the relatively long stays in the ICU. Things like severe muscle weakness, fatigue, joint stiffness, troubles of breathing, neuropsychological and psychological problems, impaired mobility and functioning. And this really highlights the importance of coordinated rehabilitation approaches, which means that there are multiple disciplines and multiple professionals working on the same issue, and the patients really need this kind of approach to be supported. And then the post-viral fatigue syndrome that can be developed into ME, which runs by myalgic encephalomyelitis. And it's better known as chronic fatigue syndrome, I think. And based on the previous research, patients up to 10% that have had COVID or are recovering from COVID could actually develop this syndrome. And why I'm talking about this, and why also the World Physiotherapy is talking about this, is that physios need to be aware of this, because if patient is suffering from this syndrome, they might have abdominal responses to exercise or the physiotherapy, and also the progressive physiotherapy can actually worsen these patients. So it's important to be aware of what is possible and how the patient is actually feeling and responding to the exercise. And yeah, also the patients, but also the family should be supported with psychological help. And also the long stays in the ward or in the ICU and the hospital, away from social contacts and family, like Lena said, even if you don't have COVID, but especially if you're being in the hospital, it might also lead into negative impacts on mental health. So these are important issues. Okay, then greetings to all the Dutch guys who are following. I believe there's a few of you. You have a good Society for Physiotherapy that has made good recommendations for physiotherapy after the hospital discharge. And here you can see the summary, or I've collected a few things from the summary. But like we have talked here, there is still uncertainty about the contagiousness of the disease, but also about the physical capacity and the physical limitations of the patient who have had this. So we need to be safe for ourselves, but also be quite cautious when we assess and treat these patients. And social distancing, e-health, telehealth should be used in physiotherapy whenever possible. So visiting the patients as little as possible. And of course, always, wherever you are, it's important to refer to the national guidelines on safety, infection control. But the initial 6 weeks after hospital discharge, most important thing I think is to try to get back into the activities of daily living and do the exercise or perform the exercise in low to moderate intensity. Here are some advised outcome measures to be used. For example, patient-specific functioning scale gives a good idea about daily living and functioning in there. Or then the Boris scale for shortness and shortness of breath and fatigue. And as you can see here, they recommend to use a score 4 out of 10, and 3 to 4, that's low to moderate. So yeah. And of course, important to work if there's a possibility to make a good assessment for the client. Of course, that's important, and really those measures that allow an understanding of the physiological limitations are important. But then also the loss of weight and muscle mass is really important to assess and treat in this case. As we all know, we need that in our lives quite strongly. After 6 weeks, probably a new assessment is good, whether there is indication for physiotherapy and what are the next treatment goals related to these patients. There are a few more recommended outcome measures. As you can see, short physical performance battery, 6-minute walk test. So here we assume that the patient is already in this stage that they are able to gradually increase the training and the frequency and the intensity, but also important that the patients understand themselves what is their state and what they are capable of and what is safe for them. But as you can see here, we can already go a little bit higher in the intensity, 60 to 80% of the, if there's been tested for the maximum exercise performance. Alrighty, then just a reminder, a very good one from HUR Australia. their news magazines from May about the exercise recommendations. So like all of you remember, the normal recommendations, 150 minutes per week, or even better, 30 minutes a day, aerobic exercise, strength training 2 to 3 times a week. And HUR Australia has also taken into account here, they wanted to mention the healthy diet and the protein intake, especially when we think about the muscles and the loss of muscle mass. It's important to keep in mind. I will just check now, there's something maybe. Okay, I hope there's nothing wrong with my presentation, but yeah. So, and of course, if we're talking about elderly, also balance and mobility training is very important. So that should be done also a few times a week. But during COVID-19, many elderly people especially have been, and all of us others have been home in isolation type of circumstances. So it's important to still keep up with the exercise, walking, gardening, cleaning, whatever you can imagine, and also maintain muscle strength by the exercises in home. And again, keep up with healthy diet. And then hopefully we are able to kind of return to the maybe normal or the new normal, I don't know, but the time will tell. But again, return to the normal exercises, to the progressive strength training, and of course maintain the healthy diet still. And HUR Australia has also made a great document about home-based alternative exercises, because there's been a lot of people asking, what can we do? We're home, what can we do? How can we maintain our physical function as good as possible? And I don't know if you can see, but here on the upper side of the slide, there's a link to this document. And in this document, you can find warm-up exercises, strength training exercises, stretching and balance exercises that can be kind of done. All of them can be done at home, but here you can see a few exercises that are alternatives to our strength training equipment. And of course, if it's possible for the individual, then also adding a little bit extra weight it's never bad. For example, ankle weights or these kind of small water bottles or anything, if the physical function is good enough. Not checking the time. Okay, still on time. Yeah. Here you can see more examples, the push-up or chest press. And here are a few balance exercises, tandem stand, standing with one leg, standing up on the toes, and then a few stretches as well. But like I said, from the link, and you will be, like I answered in the question earlier, you will get all of the materials that we've been showing you here, so you can find the link also from there. If you want to contribute or distribute this to your clients or your family or use these yourselves, please feel free. Okay, so how can we contribute or give any ideas during this difficult or new time? And the problem is people are told to be home, to avoid large groups, and especially if they belong to the risk groups. So the immobilization itself already is a major health problem, not even mentioned all the people who've actually suffered from COVID. And the gym centers can't really serve same old kind of capacity or how do you say? Well, anyway, and the people might not want to come. They are afraid, and they actually, of course, there is a bigger risk to get infected if you go to the gym or the, let's say, regular kind of gym. And this really requires a new way of thinking and maybe doing the same strength training in a new way or in a new place, maybe. And one solution could be this decentralized gym services. So with our system, like you know, with our smart touch system, you still have the data in one same place, but in here the idea is to decentralize these gym services into little facilities or little units around a facility, for example, elderly care home. So you could have 2 to 3 machines next to each other somewhere, or even one machine here, one machine there. And because our machines can fit in a little bit smaller place than the, let's say, conventional gym machines, it is possible to locate these machines maybe in places that the other machines could not be located. And as they are quite silent because of the air pressure, they could be even on the hallway or in areas where sometimes music is played or whatever, because they don't really disturb that in that kind of way. And these gym units could even have specialized purposes like force prevention here, cardio here, balance training here. And because they're not so heavy, the machines, they can be relocated quite easy. You need one really strong guy or 2 strong guys to move the machine. So compared to weight stack systems. So basically we need to go from this you see on the left side to this you see on the right side. And this picture is taken before COVID-19, so maybe the distance between the machines could be a little bit bigger. But anyway, this is the idea. And also here beneath you can see our free trainer, and this could be even placed in the patient room to be used, and their own free training program could be there. And they could do the training in their room without even leaving the room. So there are options. And also this one I wanted to mention, here's our multifunction machines, 4 and 5X, which means that there is 5 activities in the other one and 4 in the other one. So you can do 5 or 4 activities in the same place, sitting on the same seat. So it doesn't require moving around, and it can be cleaned after the one patient, and that's it. And for example, the combination between pulley and our multifunction machines, there are 3 machines, maximum of 15 square meters of space requirement. So you can do up to, I don't know, 100 exercises. I mean, with the pulley only, the sky is the limit. So you don't necessarily need that much space to establish a gym, so to speak. Okay, now my time is running out soon, and this is luckily my last slide. A few notes on the hygiene aspects regarding our machines. So first we have the upholstery, which is quite easy material to clean. It doesn't really absorb any impurities. And there's relatively small and little of seams that really helps to keep the cushions clean. And the handles and the frames of the machines are all quite easy to clean in the whole machine. And the screen can be used with the gloves. They just need to contain leather. And of course, when the machines are automated, there's minimal touching of the handles, and if you need to move the seat, or when it's automated, you don't have to really touch, but just the screen and the handles when you do the exercise. And of course, our cleaning products. Holy moly, disinfection wipes and the cleaning wipes are tested to beat COVID-19. Okay, this was me. Thank you very much for listening. And now I believe we have questions and answers time. I will try to end my sharing here. Thank you. Okay, Lena, please go ahead.
Yes, I try to, but there of some. Now here I am. Okay. Thank you, Arto, for very interesting presentation concerning the latest research. And a big thank you to Nuti for all the practical information that you were able to give me. And I have one question to both of you now, which you might be able to answer or at least discuss. And that is that, do you have any idea what kind of stage we are in now when talking about rehabilitation after COVID-19? So maybe you have some ideas how this is taken care of now, like in Finland, or if you have from other countries. I know those listening to us now might have very, very good information here too. So if anybody wants to share that with us, please, after this, you can send us emails or something, because this is very interesting to know what is the stage of the rehabilitation after COVID-19. And who of you would like to answer this question?
Okay, thank you, Lena. I could start to maybe share some ideas related to your question, and it's very important question. And coming to issue what we have here in Finland, so we know that, as you mentioned earlier, we don't have so many cases, which is of course very good issue. But in those countries who had a lot of those, I'm not sure. I don't have the information, but I know the discussion that there is a big worries related to that what happens after they have survived and when they are back home and so on. Because what the data I showed you today, so it shows quite nicely that they are going to have impaired physical performance, and as Nuti told, they are going to have some, let's say that some other very important and severe symptoms, for example, related to mental health and so on. And I think that, I'm not quite sure, as I mentioned, but I think that we have a lot of challenges how to organize rehabilitation processes all over the world. And one reason for that is that maybe we are not very well prepared. We don't know that much, but we are learning all the time. That's my what I understand at right now about the topic.
Thank you, Arto. And this is, as I said, if you have good information out there, so please send it to Arto, and I think he would be very happy for that. And let's see, I guess we have one question here more. Yes, it's Toire. Hello, Toire. With return to normality after COVID, should we alter our strength training protocols and dietary requirements, especially protein, to maximize the regain of strength lost due to inactivity? What do you think is the best way?
I could answer something related to this. Of course, this is a very good question, but it's also a difficult question, because what I have understood, the symptoms and how long they are going to last, there is a lot of variability in this. And that's why I think that the individual approach would be needed very much. We know very well that even though we take a look about the healthy subjects when they are doing exercise training, and we are measuring some health-related outcomes, blood pressure, maximal strength or whatever, the responses are going to be very individual. So low responders, high responders, most of those middle responders and so on. And I believe, and during this pandemic era, we need to take a look much more individual approach to build up the eating guidelines and or individual eating guideline and individual exercise training programs. So this is my idea, what I believe right now.
Okay, thank you so much. And Since it seems that we don't have any other questions, I just want to thank you all here at the end. And it has been really lovely to have you all on board, so to say. And next week, we will send you a link, or you will get all a link where you can find this recorded webinar on our website together with all the presentations. So I really hope you have been enjoying this today. And this was like, in a way, the first trial we had from HUR in Finland. HUR Australia has done a marvelous job with the webinars before us. But I'm sure we will continue this now, since traveling is not allowed and it's hard to meet up face to face. But thank you from the bottom of my heart, all of you, and let's really stay safe and take care of each other. So, bye-bye.
Thank you. Bye-bye.